My name is Dr. Stephen Glassman. I'm a practicing dentist for over 40 years. I practice in the Upper West Side area of New York City. Even though I've been doing this for 40 years, I could look at a patient's x-ray scans and examine them and have a really good idea in the position they're headed. And it frustrates me where I know where they're going, what the outcome is going to be, and they look at me with those glass eyes, especially those patients that have no symptoms at all, and they're saying, Doc, I feel fine, why should I do anything? Especially a chronic thing where people start to wear their teeth around, it doesn't happen overnight. I kind of use the analogy with my hair, I look at pictures 10 years ago, geez, I had a much fuller set of hair 10 years ago. What happened? It's kind of that slow, chronic area. But I'm trying to gain their confidence. I've been using the Lumina scanner for about a year now. I could show patients how their teeth meet together, and then if they're in a situation that's not ideal, I could show them this is the cause and effect. I said, see here when I show you the scan and I put it into stone mode, I can show you the actual chip on that tooth. And perhaps if I scanned you 6 months ago, which a lot of patients get scanned periodically, I could show that that situation, that chip of the wear is actually getting worse. And I could start talking to them, this is the pathway. If this happened in 6 months, what is this gonna look like in 5 years? So it starts my conversation rolling. And I always go back to them, look them in the eye, would you like to avoid costly dentistry and more invasive dentistry in the future? And for some patients, that's just enough to say, let me hear more. Using the near infrared imaging, where I could pick up interproximal cavities, oftentimes before they show up in x-ray, and the patients can see it right on the scanner. And then we also can show them what it looks like with the high definition camera. So we can start to show that that tooth is cracking, the cavity getting worse, and that gets another screenshot. So all this information is going on with this code discovery and this identification. Gearing them towards the whole endpoint is to find a treatment plan that deals with this early treatment that's comprehensive, that the patient will accept. One of my favorite features is the Outcome Simulator Pro, because patients that do not have an ideal bite or they have a wear situation, in the past, using some of these analog methods, we would take an impression, or even if we did do a digital, we would send it off to a laboratory, we'd get it planned ideally with a digital wax up, we'd go to the whole motional stage, but that does something that delays treatment acceptance, in my opinion. So having a tool chairside that I could show them immediately what the teeth would be aligned ideally orthodontically, and what would orthodontically and ideal restorative looks like. And not just have a model, have them actually see it in their face. And if we do it correctly, we get them to show some emotion in their eyes, and we go through it, and you can see oftentimes that with the corrected alignment and the corrected orthorestorative, the patient looks happier, they often look younger, and really drives case acceptance. Well, in the past, using the old tools like a mirror, previous photos of case and x-rays, I would kind of cringe when the patient would look at me like, what is he trying to sell me? But today is so much more relaxing and comfortable for me because I have all that information to back what I'm recommending right in front of the patient. And it just feels so easy to recommend ideal treatment. The hard part is getting the patient to say yes. With the digital workflows we have today, the execution has become so easy. Whether it's a single crown that drops in with minimal to no adjustments, to a full arch case where we're scanning upper and lower restorations and putting them in together in record time with minimal to no adjustments. It just creates a remarkable workflow that in my 41 years I've never seen before.